The 10,000 step goal was invented in 1965 by a Japanese company marketing a pedometer called the Manpa-K, which translates literally to 10,000 step meter. It was a marketing number, never derived from research, never tested in a clinical trial, never validated as an optimal health target. And yet it became the global standard. Here is what the science that came after it actually revealed, and it is more nuanced and more actionable than the marketing myth. Walking is the most underrated performance tool available to you, cognitively, cardiovascularly, and metabolically. Recent meta-analyses of hundreds of thousands of people show that 7,000 daily steps dramatically reduces all-cause mortality risk, and that walking pace is an independent predictor of brain health separate from step count entirely. Here is what the peer-reviewed evidence actually shows, and why it is more actionable than the marketing goal. Today's evidence comes from Amanda Palak's landmark 2022 JAMA Network open meta-analysis pooling 226,000 people across 17 studies, Kai-Pang Wen's Lancet research on walking duration and mortality reduction, Masaka's systematic review in translational psychiatry on walking pace and brain health, and Tudorlock and Bassett sports medicine analysis revealing exactly where the 10,000-step marketing goal came from and what has been learned since. Amanda Palak's 2022 JAMA meta-analysis pooled data from 226,889 people across 17 independent studies to answer one question definitively. How many daily steps does it actually take to reduce mortality risk? The answer was 7,000. Participants walking at least 7,000 steps per day showed a 50 to 70% reduction in all-cause mortality compared to those walking fewer. Above 10,000 steps, the benefit curve flattened significantly, particularly for adults over 60. The dose-response curve for walking and all-cause mortality reveals where the real leverage lies. Going from a sedentary baseline to 4,000 steps produces a 30% mortality risk reduction. Reaching 7,000 steps delivers 65% reduction, nearly the full benefit. 10,000 steps adds only another 7% above that. The entire difference between 7,000 and 10,000 steps represents marginal gain. The research strongly favors 7,000 as the actionable, realistic target. A 2022 systematic review by Masaka's and colleagues found something that the step count literature had missed. Walking pace is an independent predictor of brain health, separate from total steps taken. Participants who walked at a brisk pace showed significantly larger brain volume and scored higher on cognitive assessments than slow walkers, even when total daily step counts were similar. Pace, not just quantity, determines how protective walking is for the aging brain. The 10,000 step target is arbitrary in origin, but the research that has studied it reveals it is approximately right for younger adults, with important nuance. For adults under 60, more steps continue to provide incremental benefit. For adults over 60, 6,000 to 8,000 steps captures most of the mortality reduction. And for everyone, brisk pace delivers brain benefits that a slow 10,000 step shuffle does not. The real goal, 7,000 or more, at a brisk pace. The science-based walking system does not rely on hitting a pedometer number. It relies on building two anchored walking habits that naturally accumulate to the evidence-backed target. An after-lunch walk of 15 minutes plus an after-dinner walk of 10 minutes produces roughly 2,500 steps from structured activity. Combine with the movement you already do and you reach 7,000 without a dedicated exercise session. Aim for brisk pace, zone 2, where you can speak but not sing comfortably. 5 walking habit moves that accumulate steps without requiring a dedicated exercise session. A 15-minute post-lunch walk anchored to your existing meal routine is the single highest impact change available. Park at the far edge of every lot. Turn all phone calls that do not require a screen into walking calls. Default to stairs for anything under 5 floors. And baseline your current steps for 1 week before targeting 7,000. 3 if-then plans that embed walking into time you are already spending doing nothing active. After finishing lunch, walk for 15 minutes before returning to work. Calendar it as a recurring block. Any phone call that does not require a screen becomes a walking call by default. Any time you are waiting for something, a meeting to start, food to arrive, a download to finish, that time is automatically walking time. No extra schedule required. 10,000 Steps was born in a Japanese marketing department in 1965 and has never been corrected by the fitness industry. The science tells a simpler, more achievable story. 7,000 brisk steps per day reduces all-cause mortality by 65%. Brisk pace independently protects brain health. 2 anchored 15-minute walks get you most of the way there without a gym, a program, or a training schedule. Start where you are and build from the data. Subscribe to Habits, backed by science for peer-reviewed research that replaces fitness industry myths with what the evidence actually shows. Put your after-lunch walk in your calendar right now as a daily recurring block. 15 minutes at a brisk pace. Every day. That single habit will contribute more measurably to your long-term health and cognitive function than most gym programs people commit to and then abandon.